Present a case report and a sad story of female shedding their nipples. 16 years old female presented to us with periodic shedding of both nipples, started at time of menarche, recurred every 3 months, especially after or during the menstruation, patient would otherwise in good health and no family history of similar cases. Examination revealed absent nipples, normally looking areola, no signs of inflammation, and the mother showed us an intact shed nipple that shed before that was firm and keratotic. Dermoscopic appearance revealed absent nipples and picture of keratinized substance. Histopathological examination revealed epidermal acanthosis, hyperkeratosis, and keratin plugs. So we started to search for differential diagnosis to a similar condition, and we tried to exclude and include other abnormalities of nipples and areola. We started to think of hyperkeratosis of nipple and areola, but it was in the second or third decades, especially in pregnancy and postpartum. Mostly it involved nipples and areola, but our case involves nipple only with normal areola. It's related to excess of estrogen because it may start in puberty, worsen in pregnancy, and occurs with estrogen therapy. Hyperkeratosis of nipple and areola has never been reported to be associated with shedding of nipples, so this diagnosis is unlikely. Our second differential diagnosis was inverted retracted nipple that affects both genders. Usually no underlying cause, may result due to candidal infection, dilated mammary ducts and mastitis, or breast cancer. Inverted nipples are not preceded with hyperkeratosis or shedding or shedding of nipples, so this diagnosis is also unlikely. Our third differential diagnosis was dry nipples that may caused by chafing, contact dermatitis, and Paget's disease. This also is not associated with shedding of nipples, so this diagnosis is unlikely. So, surprisingly, while we were searching for the differential diagnosis and trying to diagnose this case, another case was referred to my professor with the same clinical picture, 19 years old female with history of 3 years of recurrent nipple shedding. The condition recurred every 6 months with normal hormonal profile and no history of similar condition. And on examination, hyperkeratotic blackish area replacing the nipple and also normally looking areola and no signs of inflammation. These were the pictures on examination. And this were after 1 month, the keratinized substance shed. And 4 months later, bilateral nipple shedding occurred. And after 2 months, regrowth of new nipples that undergo hyperkeratinization. Histopathology, as we said before, showed keratotic lesion showing epidermal acanthosis and hyperkeratosis and keratin plugs. Final diagnosis based on the classic unique clinical picture, exclusion of all other nipple abnormalities, dermoscopic examination, and histopathology. The final diagnosis is periodic shedding of the nipple. Periodic shedding of the nipple is an extremely rare phenomenon characterized by periodic shedding of both nipples preceded by hyperkeratosis, typically at menarche, recurs periodically every 3 to 6 months. Shedding occurs during or after menstruation and completely asymptomatic. The incidence, periodic shedding of nipples has not been reported before this case. Pathogenesis, it's related to hormonal changes, onset at menarche, periodic recurrence in relation to menstruation, related to hyperkeratosis. The keratin plugs decrease the nutrition of nipple epidermis and led to shedding of the nipples. Regrowth of nipples undergoes same sequence of events and may be a variant of hyperkeratosis of nipples. histopathology acanthosis, papillomatosis, and keratin plaques before shedding. The clinical picture, apart from shedding of the nipple, there are no other abnormalities. And as we said before, the differential diagnosis is hyperkeratosis of nipple and areola, inverted retracted nipple, and dry nipples. The treatment, as a condition is related to hyperkeratosis of nipple and areola, it may respond to the promoters of differentiation as retinoids and vitamin D3. Thank you.
شكرا جزيلا للدكتورة لبنى جمال.